The primary objective of nursing is. Correct answer is option C. Promotion of health and prevention of illness. A nurse should prioritize which of the following when caring for a patient. Correct answer is option C. Patient's rights and safety. The most appropriate action when a nurse finds a medication error is to. Correct answer is option B. Inform the supervisor immediately. Which of the following is a principle of effective communication in nursing? Correct answer is option C. Active listening. Empathy in nursing means. Correct answer is option C. Understanding and sharing the feelings of the patient. Accountability in nursing means. Correct answer is option C. Being answerable for one's actions. The nurse-client relationship is based on. Correct answer is option C. Professional trust and respect. What is the first step of the nursing process? Correct answer is option B. Assessment. Which nursing value emphasizes do no harm? Correct answer is option C. Non-maleficence. When a nurse maintains confidentiality, they are showing. Correct answer is option C. Ethical responsibility. Which of the following best describes informed consent? Correct answer is option B. Patient voluntary agreement after understanding risk and benefits. Critical thinking in nursing involves. Correct answer is option B. Applying logic and reasoning to make decisions. The ethical principle of fidelity means. Correct answer is option A. Being faithful to promise and commitment. Which is an example of non-verbal communication? Correct answer is option B. Smiling at a patient. What does delegation in nursing mean? Correct answer is option B. Assigning tasks to others appropriately. The best way to handle a conflict with a colleague is to. Correct answer is option B. Discuss openly and respectfully to find a solution. Which of the following is a legal document that describes a patient's wishes for end-of-life care? Correct answer is option B. Living well. A nurse demonstrates cultural competence by. Correct answer is option B. Understanding and respecting patient's cultural background. Patient advocacy means. Correct answer is option A. Speaking and acting on behalf of the patient's best interest. Which part of the nursing process involves setting measurable goals? Correct answer is option B. Planning. Confidentiality can be broken if. Correct answer is option A. Patient consent to share information. The most effective way to ensure patient safety is. Correct answer is option B. Following protocols and double checking. Which nursing theorist is known for the self-care defect nursing theory? Correct answer is option C. Which quality is most important for a nurse during a crisis? Correct answer is option A. Patience. Which of the following best describes prioritization in nursing? Correct answer is option B. Performing tasks based on urgency and patient needs. The primary goal of patient education is to. Correct answer is option B. Promote health and self-care. Which is not a part of the communication process. Correct answer is option D. Assumption. What is the best method to verify a patient's identity? Correct answer is option B. Checking the patient's waistband and asking their name. Nursing ethics are primarily based on. Correct answer is option B. Professional codes of conduct. In the event of a medication allergy, the nurse should. Correct answer is option A. Document it and notify the physician immediately. A therapeutic communication technique involves. Correct answer is option C. Using open-ended questions. The best way to improve critical thinking skills is. Correct answer is option B. Reflecting on clinical experience. Which is a sign of professional boundary violation. Correct answer is option B. Accepting expensive gifts from patients. What is the nurse role in pain management? Correct answer is option A. Assessing pain regularly and advocating for pain relief. The first step in conflict resolution is. Correct answer is option B. Identification of the problem. Which is an example of primary prevention. Correct answer is option B. Educating on healthy diet and exercise. The nurse notices a colleague is intoxicated at work. What should the nurse do? Correct answer is option B. Report to the supervisor confidentially. Which nursing intervention best supports patient autonomy? Correct answer is option B. Providing information to help patient make informed decisions. A nurse practicing beneficence well. Correct answer is option A. Act in the patient's best interest. What should a nurse do if a patient refuses treatment? Correct answer is option A. Respect the patient decision and inform the doctor.